So many of the front pages today will be pleasing to the Prime Minister. Volunteer army, booster jabs, all focus on the boosters, people queuing up, the website crashing because people are so keen, people queuing 5 hours. It's great news that people are getting the booster, and that's fantastic. The trouble is, once again, the NHS has become the national COVID service.
Exactly. And, we've got to get a sense of balance. There are two priorities in the NHS. Number one, the boosters, which are a good idea, but you don't need a lot of doctors doing that. You need one doctor per centre, just in case anyone collapses. The reason people usually collapse at vaccination centres is they faint. It's not a serious business.
Yeah, you don't need some 7 years of medical school and years of experience as a doctor to oversee putting jabs in arms. I imagine that after 10 minutes I could probably manage to do it.
You could. After an hour, you'd be perfectly competent with an orange and a syringe, and that's how you train people to do intramuscular injections. And it's the same 50 years ago when I was a student, so why not now? The second problem is what do you cancel in the NHS in case there's a swamping of the system. So every winter we cancel operations. That is routine, it's winter pressures. But on top of that, you've got this sort of background of fear, which is passed on to patients and possible patients, which means they can't access their GP, they can't access the hospital system. They're told they're not important because they're prioritizing people with COVID. Therefore, you just have to sit at home with your constellation of symptoms. You don't know what's wrong, you don't know if you've got cancer until the diagnosis is made, and other illnesses as well. And that's the weakness in the system. If we stop doing everything because of the boosters, which are a logistic challenge, they're a sort of military type challenge, they're not a medical challenge, it's just a matter of website crashing is a bad sign, and that shows logistics failure. So what we've got to do is get away from medicine for the boosters, just get on with it, and protect those that have unusual symptoms that need investigation.
But, and this is the thing, we had those stats a couple of weeks ago, 740, this is from the Office of National Statistics, and I think they know, National Audit Office, sorry, I think they know what they're doing. 740,000 cases that would normally have been referred by GPs. There was enough concern from a GP to refer it to a cancer specialist for a test that simply didn't happen during the whole of the pandemic to date. We're now told by the Cancer Research Organisation that 5,000 cancers a month are being missed right now. The reality is, one of the reasons why we've had actually quite low, relative to our European neighbours, quite low survival rates for cancer is because we just don't get people, they don't go to the doctor soon enough, they don't get referred soon enough, they don't start treatment soon enough. The time is of the essence when you have cancer. Most cancers, if caught early, treated quickly, you don't die from. We can have some amazing success rates. People waiting a month or two is the difference between life and death, isn't it?
Completely. Within 3 months, a cancer can go from stage 1 with a 90% chance of complete cure to stage 3, which gives less than 20% chance. If you have a cancer, lung, breast, colon, prostate, the 4 common ones, they're all the same. They behave just like that. So what we've got to do, and the other problem for GPs, however good the GP, he or she can only pick up 25% of cancers. The rest need investigation. They need a CT scan, they need an MRI, they need something. And you can only get that at the hospital, which means the patient's got to go to the GP first, which is currently a challenge, and then they've got to get to the hospital, get on a waiting list for something. And that is the tragedy. If you prioritize COVID, you lose the cancer patient.
But the thing is, this is what we did in March 2020, and we saw very quickly, and I can remember talking to you the first time I interviewed you was about your concerns about this way back in spring 2020. We've learned all the lessons of that when we've got cancer charities and National Audit Office and everyone else saying this was crazy. We must never make that mistake again. And they tried not to make that mistake too much again in 2021 when we started locking down in January. But again, nevertheless, still a big impact because people don't come forward. People are scared of going into hospital, etc., and people just being turned away by the GPs or having a phone appointment as opposed to being seen in person and being able to show their symptoms more clearly. We are literally making the same mistakes we made 21 months ago, and for some reason expecting a different outcome.
I find it so difficult to believe that we could be doing this. And reading yesterday and today, the strategy shut down the NHS for newcomers, basically concentrate on COVID jabs. This is crazy. All the data for Omicron is not as bad as it's being made out to be. You mentioned earlier about the one death. We have no details. No doctors have any details on it. Was it from COVID? Was someone run over by a bus? Any death is a tragedy, but we need the information. And it looks like scaremongering by Boris and his people. And I think we've got to get away from that. We've got to be much more responsible in terms of how we prioritise healthcare for a whole population of 66 million people.
Yeah, I mean, that's the thing, isn't it? I mean, we're looking at these booster jabs going out. As you say, there was more than 4 million hits on the website. The website crashed briefly. People queuing up at walk-in centres, waiting 5 hours. I mean, God, do these people not have jobs? 5-hour wait for a vaccine? The Prime Minister's called for an army of volunteers. Now, I know that from an embargoed press release that was supposed to be with Sajid Javid giving interviews last Monday, when, of course, this video had emerged of everyone laughing in Number 10 about this party they didn't have a few days earlier, that was supposed to have been announced a week ago. I mean, it might have been more useful to announce it before, the 12th of December, when it was announced on Sunday night. Hundreds of pop-up centres, the military involved. Apparently, we're going to have 24-hour day centres, Christmas Day opening. I mean, it's all very well, but a lot of these things were ruled out last time round because people don't want to go and get a jab at 3 a.m. People don't want to go and get a jab on Christmas Day, probably not even on Christmas Eve, because I know an awful lot of people feeling very unwell after their jabs. I certainly was absolutely not for 36 hours by my first jab. So a lot of this is just sort of it's PR, isn't it? I mean, the real worry is a lot of the focus on this, which is very different from what has been happening in the EU and what we've seen for 4 weeks in South Africa. A lot of people are saying there's more politics in this than science. What do you make of that?
It's politicians wanting to show they're being decisive, and that's the problem. As soon as Omicron came, we had a very different response than what we had a year ago when the whole thing started. Omicron will take over from Delta. It's bound to. It's going to do that everywhere, right around the world. It's faster transmitting. It avoids, at least in part, the immune system. But what we don't know, is it more severe? It looks as though it's not so severe. And that's the way the virus is trying to gain ground. It wants to live with this. It wants to be friends with this, believe it.
Wants to keep us alive. Well, I mean, the reality is, look, can we realistically compare South Africa and the UK? I mean, South Africa, much younger population, they much lower vaccination rates. We're an older population, much higher vaccination. I mean, much higher vaccination rates. They have seen over 4 weeks. I mean, we spoke to Angelique Coetzee, the chair of the South African Medical Association, who was one who helped identify Omicron, and she thinks that this is all just crazy scaremongering here. And she's not aware of a single death, and they're saying their reports of lower severity, and their case fatality rate has plunged. Now, is that just because it's only young people getting it at the moment in South Africa, and are we going to see it worse here? I mean, is there good reason to be concerned about the future, if not right now?
There's a good reason to look at the data very carefully. And as every day goes on, the data get more solid. And it does look as though it is more transmissible. It is a younger population. As you rightly say, it's not a vaccinated population. But the death rate it does happen in South Africa. There have been deaths, but they're not huge. They're much smaller. And I've seen the curve as of yesterday, and it's much flatter than what we've seen with Delta. And so the lesson, and the other good thing about the South African data, because it affected them 3 weeks before us, we can see a trend that almost certainly will follow in the UK. And it's right to get the boosters done, but not to stop the NHS because of it.
Yeah, absolutely. And in terms of further restrictions, vote tonight. The Prime Minister is facing a large mutiny, but it's not going to be enough to stop those measures coming in, simply because the Labour Party are going to be voting with the government. The Prime Minister refusing 3 times in an interview yesterday to rule out any more restrictions after Christmas. Government Health Secretary says no plans. We know what that's code for, given that Whitehall is apparently already looking at restrictions on hospitality. Again, the evidence I've seen, there's no evidence that's convincing about masks. Certainly no evidence, almost the opposite actually, in highly vaccinated societies about vaccine passports stopping the spread or convincing more people to get vaccines. And certainly no evidence that hospitality is a wide source of spreading of this disease either. And yet all these measures are going to be brought back in, and goodness knows what's going to happen to kids at school.
it is a worrying time. And all I can say is I hope that as we get more data from South Africa and as it matures here in this country, the fear will go, the hospitals won't get filled up, the ICUs will remain empty, and we'll be able to get back to business as usual in the NHS and drop the level of fear, because that's what's happened. The last week or two, the media, especially the main media, has raised the level to a disproportionate height.
Yeah, I couldn't agree with you more. Professor Karol Sikora, thank you very much, as always, for talking to us. 7